Good day everyone. We are the group 4 and the assigned topics for us are the problems or the anomalies of the placenta. And under these problems of the placenta are the placenta succenturiata, placenta circumvallata, battledore placenta, filamentous placenta, vasa previa, and placenta accreta. We are the reporters for these topics. I am Jezebel de la Cruz and my co-reporters are Miss Blessy Danglapen and Miss Eliza Joy Gapati. And our instructor for this subject is Mr. J.V. Edwardson Avisa. The given topics for me are the placenta succenturiata and placenta circumvallata. But first, before discussing these two topics, I will be defining what is placenta. The placenta is an organ that develops in the uterus during pregnancy. It originates from the blastocyst shortly after implantation. The role of the placenta is to provide oxygen and nutrients to the fetus and remove waste from the fetus blood. The placenta is attached to the uterine wall and connected to the fetus via the umbilical cord. The picture provided here is what a placenta looks like. The placenta and cord are always examined after birth. The normal placenta weighs approximately 500 grams and is 15 to 20 cm in diameter and 1.5 to 3 cm in thick. Its weight is approximately 1/6 that of the fetus. A placenta may be unusually enlarged in women with diabetes. In certain diseases such as syphilis or erythroblastoses, the placenta may be so large that it weighs half as much as the fetus. If the uterus has scars or a septum, the placenta may be wide in diameter because it was forced to spread out to find implantation space. Placenta succenturiata. So what is placenta succenturiata? Placenta succenturiata is a morphological abnormality of the placenta where one or more of the lobes are present outside the placental body. These can have different sizes and are connected by blood vessels to the main placenta. The accessory lobe develops from the chorionic villi that did not involute from the mild chorion. In anatomy, succenturiate means accessory to an organ. In this case, a succenturiate placenta is an accessory placenta. Who gets placenta succenturiata? According to age and sex distribution. Placenta succenturiata occurs in approximately 2 per 1,000 pregnancies. There is no distinct racial, ethnic, or geographical predilection observed. What are the causes of placenta succenturiata or the etiology? A succenturiate placenta is formed by non-involution of the chorionic villi, which means that some of the chorionic villi fail to disappear, resulting in the formation of an extra lobe of the placenta. Chorionic villi arise from the embryonic membrane or the chorion, and their function is to provide the maximum area of contact between maternal and fetal blood circulation. The disc shape of the placenta is due to the result of remodeling of placental tissue during its growth, wherein some chorionic villi disappear, leaving behind a disc-shaped placenta. What are the signs and symptoms of placenta succenturiata? There are no specific signs and symptoms associated with this. They are usually found during a routine ultrasound examination performed during pregnancy. A placenta succenturiata is not associated with an increased risk of fetal anomalies. How is placenta succenturiata diagnosed? A placenta succenturiata is diagnosed by an ultrasound scan of the abdomen of the pregnant woman. What are the possible complications of placenta succenturiata? Complications due to an placenta succenturiata could include increased chances of postpartum hemorrhage due to retained placental tissue, increased incidence of vasa previa. In vasa previa, the fetal blood vessels run over the maternal cervix with an increased risk of rupture and bleeding. Vessels connecting the main and succenturiate placenta may rupture and causing fetal compromise. How can placenta succenturiata be prevented? Currently, there are no definitive methods available to prevent placenta succenturiata. Proper antenatal care is essential to ensure a healthy pregnancy and uncomplicated delivery. What is the prognosis of placenta succenturiata, or the outcomes and the resolutions? The presence of succenturiate placenta does not result in a higher risk of fetal abnormalities. There is an increased risk of bleeding after delivery, which requires careful monitoring. The prognosis is excellent with a suitable care and management during delivery. Additional and relevant information for placenta succenturiata. According to one study, the incidence of a placenta succenturiata was higher in pregnancies using in vitro fertilization. During in vitro fertilization, a man's sperm and a woman's egg are fused to a laboratory dish. The next topic is all about placenta circumvallata. So what is placenta circumvallata? Placenta circumvallata is an abnormality in the shape of the placenta. It can result in a lack of nutrients for the fetus. In circumvallate placenta, the chorionic plate, which is the part of the placenta that's on the fetal side, is too small. That causes the membranes to double back on the fetal side and around the edges. Are there any symptoms or warning signs? While circumvallate placenta does not always cause symptoms, some women do experience some pregnancy issues that lead their doctors to feel like circumvallate placenta might be a possibility. Here are a few signs that you may have circumvallate placenta. Slow fetal growth. When a mother has a circumvallate placenta, the growth of the fetus tends to be slower. If your doctor finds that your baby does not reach the growth milestone during your regular checkups, you will need to be tested to figure out the cause. Another one is bleeding from the vagina. During the first trimester, some women experience more bleeding from the vagina than is normal. A study was conducted that concluded with the opinion that vaginal bleeding was more common in women who had circumvallate than in others. Lastly, the premature rupture of membranes. PROM takes place with the premature rupture of the amniotic sac. When PROM occurs along with the vaginal bleeding, it is a possibility that a mother has developed circumvallate placenta. What effects does it have on pregnancy? Circumvallate placenta increases your risk of certain pregnancy complications including low birth weight. Restricted growth of the fetus is the most common complication of circumvallate placenta. It's common for babies who have had a circumvallate placenta to have a lower birth weight. Placental abruption. This is where the placenta separates from the uterine lining too soon. It causes significant bleeding that puts the mother at risk. Oligohydramnios. This condition is used to refer to a decreased amount of amniotic fluid. Amniotic fluid helps cushions the baby. It's also important for fetal development including lung, muscle and bone development and helps keep the umbilical cord from being compressed, which is for providing nourishment and oxygen to the baby. Miscarriage. Circumvallate placenta can lead to death of the fetus if any of these complications are developed and are not treated promptly and appropriately. What causes it? Circumvallate placenta is a variation of placental development. Researchers don't know precisely what causes it, but it's not caused by anything you did or didn't do. Nothing can be done to prevent a circumvallate placenta from developing. If you've been diagnosed with the condition, you should be extra vigilant about rest and a healthy diet to try and prevent intrauterine growth restriction. How is placenta circumvallata diagnosed? The condition can be detected by ultrasound and is usually diagnosed around the 20th week of pregnancy. However, diagnosis during pregnancy can be difficult and the condition is often not detected until the placenta is examined following delivery. Is there any treatment? Although there is no way to treat a circumvallate placenta, a doctor may take some steps to help reduce the risk of complications or treat them. One of the primary concerns of a circumvallate placenta is the decreased birth weight of the baby. To help monitor this, a doctor may recommend more growth checks using ultrasound. If the fetus is not growing fast enough, the doctor may recommend early delivery. A vaginal delivery will usually be possible, but a cesarean section might be the best option if the baby is not tolerating labor. If a woman has a placental abruption as a result of a circumvallate placenta, a doctor will usually recommend frequent monitoring, hospital bed rest, early delivery, and sometimes an emergency cesarean section. Can it be prevented? There is currently no real way to prevent circumvallate placenta as the cause is not yet known. The only thing that can be done is to make sure that mothers who have been diagnosed take very good care to follow the directions given to them by their doctor. Prognosis. Circumvallate placenta is a very rare condition. The good news is that many mothers have managed to have their little ones with no real issues, despite the abnormality. In the less fortunate cases, the condition leads to other complications that make normal delivery impossible. Circumvallate placenta risks the life of the mother and child if not managed well, so if you have been diagnosed, just remember to consult with your doctor regularly and follow all instructions. Following your doctor's advice is the best thing that you can do for your baby's health and for your health too. That would be all. The succeeding topics will be discussed by Ms. Danglapen and Ms. Gapati. Thank you for listening and have a nice day. Keep safe everyone.